on the agenda. We can't do any of the action items. Let's go ahead and skip down to the informational session. Do we have anybody who, oh, I see Dr. Olasolo just came on. So it's 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 of us. Do we have anybody for public comment?
May have it. Carrie's on now, so you have a forum.
Okay. Oh, okay. Fantastic. So we have Dr. Ojo joined us and Dr. MacArthur Kearney joined us. 2, 4, 6. So we only need 6 people for a quorum?
Yes, that's above 50%.
Okay. Sounds fine. All righty. So let's go ahead and approve the agenda for today. May I have a motion?
I make a motion to approve the agenda.
Approve one edit to the agenda. We are actually going to have Adrian Jones present next month rather than this month.
Okay, so we're going to take off the environmental health.
Yes, ma'am.
Okay, fantastic. Otherwise, is there anything else? Okay, can I have a second for the agenda?
A second.
Okay, all in favor?
Aye.
Aye.
Okay, very good. May I have, hopefully everybody's had a chance to look over the meeting minutes. The only correction that I do have is on page 3. If you could correct from Mr. Ojo to Dr. Ojo on page 3 at the top.
Thank you.
May I have a motion to approve the minutes?
Motion to approve.
Second.
May I have a second, please?
Second.
All in favor?
Aye.
Very good. The next is the approval of next year's meeting schedule.
Can I have one time before, if the board is okay? Remember in our September meeting, in September, that's when our flu shot clinics typically happen, or we start them in October. So depending on when the Board of Health, or depending on when the Board of County Commissioners fall, in order to get our flu shot fees approved in time, we may need to have a September meeting. This year, we had to have a special meeting in order to get it approved. It just depends on how the Board of County Commissioners agenda falls. Otherwise, we get delayed too far into October to get started with flu shots. So just keep that in mind, that in September, we may need to have a special meeting to get our fees approved. It's not likely that we'll have the Medicaid rate in August. And if we don't have a September meeting, that means we won't get the fees approved until October, which means we won't be able to start flu until November, if we don't have a September special meeting.
Okay, so why don't we just put on down for a meeting in September then? How does everyone feel about that?
It works for me.
That's fine.
All right.
I think we don't have meetings in September because there's a conference going on concurrently, which we don't have in 2020.
Yeah,
So
but then,
I remember last year in September we were in Greensboro for a conference, and I think that was why the September meeting is optional.
Correct. There was a conference in last September, but it was canceled this year.
Yes.
Like,
What,
yeah.
what I'm trying to say is we never know what's going to happen next year, 2021.
So if the board does not want to do a September meeting, just be aware we may do a special meeting, even if it's a short special meeting like we did this year to approve fees.
It's okay to have a meeting in September 2021. I'm just making a point, just to bring it to attention why we don't normally have a meeting in September.
yeah, but to be honest with you, most of the board doesn't attend the meetings. So why don't we just go ahead and schedule a meeting? And that way it's on everybody's calendar. and, and then we don't have to call these special meetings because it's on everybody's calendar.
That's okay.
And then why don't we go ahead and change this, all the meetings say 2020. I don't know if that was caught. Yeah, that needs to be changed, 2021. So are those dates actually correct?
Yes, the dates are correct. The year just needs to be 2021.
Okay, very good. And then if, Kelly, if you could send a calendar invite, and that way it'll just be on everybody's calendar.
Okay, no problem.
Thank you so much.
One more thing, the dates are not correct as well.
Say that again?
The dates are not correct. The first Tuesday in January will be January 19, 2021, not January 21. So we need to fix the date as well.
So I can go through.
Oh, yeah, she's correct. That's a Thursday.
February will be February 16.
Yep.
I have a wrong one in there.
March will be March 16. So we need to fix all the dates.
So January will be January the 19th. I can go through them quickly. January will be January the 19th. February will be February the 16th. March will be March the 16th as well. April will be April the 20th. May will be May 18. June will be June
15.
July will be no meeting in July unless desired, which would be on the 20th. The August meeting will be on the 17th. The September meeting will be on, if approved by the board, would be on the 21st. October meeting would be October the 19th, and November meeting will be on November the 16th, and then the Tuesday meeting, December meeting would be on December the 14th, or I'm sorry, December the 21st.
Okay.
We'll send out the corrected calendar.
And a calendar invite for all of them. Thank you. Can I have a motion to approve those dates?
Motion to approve.
Second.
I second.
All in favor?
Aye.
Aye.
Thank you so much. Okay, so you said that there were no public comments for tonight?
Ma'am.
Okay, very good. So let's move on to the financial report with Ms. York. And again, if everybody would move themselves, please.
In your packet, beginning on page 8, you have the monthly financial reports that for the month ending October 31st, 2020. At the close of the month, the revenues exceeded our expenditures by $212,010.23. On page 9, we have the expenditures by program. At the close of the month, we had expended 26.21% of our budget. If we had spent 100% of our budget, we would have expended 33%. This is due to lapsed salaries and then the timing of other operating expenses throughout the year. And as you can go through and look at some of the programs, you'll see that some of it has not been used. And that was a lot of times, like the very first one would be our Healthiest Cities and Communities grant. At this point, we had not expended any dollars, but we have started that program. So you will start to see expenditures there. So different programs, as I said, just are in the process of getting started, which lowers our expenditures. On page 10 is your revenue report with your state and federal allocation, collections, and grants. On page 11 are our Medicaid collections at the top. We have actually collected 34.24% of our budget, which is a little bit more than 33% where we would be on target. I'll draw your attention to the second line that says escrow NC STD, which is really communicable disease. It's just a description that's in the general ledger. The increase in there for this fiscal year 2021 versus fiscal year 20 is due to some COVID collections. We have been able to collect funds for patients, and then also they increased our rates through the end of the year. So that has actually, the patients that we have that actually have Medicaid, we're actually collecting more than we anticipated due to those rate increases, but they will end at the end of the year as of right now. And our fees, we've actually collected 26.32%, which is a little lower than 33% we anticipated at this time of the year. However, that is due to, we did go to appointment only, and we had to reduce the number of patients coming in to avoid a bottleneck of patients due to COVID as well. On page 12, you'll show though that overall, we've actually collected 27.13% of our budget, which of course exceeds the percentage of expenditures we've had. So therefore, we don't have any shortfalls to report. On page 13 is the accounts receivable report, broken down by the programs and also by payer source. And then finally on page 14, you have your private pay, self-pay accounts receivable report, broken down by aging and program. And I can answer any questions that anyone may have.
Very good. Okay. So Ms. Vinson is going to present the immunization flu clinic report.
Yes, good evening. So I want to go over some of the numbers from our flu clinics. First of all, I'll go over our fiscal year from fiscal year 19 through 11, today's date, 11/17/2019. From that time last year, we did 430 flu shots. Fiscal year starting 2020 through today, we have done 264 flu shots. I'm gonna just kind of briefly go over the numbers for the flu clinics that we have done outside the health department. The first one was our drive-up clinic at Falls Run Baptist Church. We provided 32 flu shots. Our next date was an in-person clinic at Fayetteville State University. We provided 13 flu shots. And today we were at Alliance Health, Behavior Health. We provided 37 flu shots. So as of date, for our outpatient or our outreach clinics, we have provided 82 flu shots. We do have some upcoming events. On Tuesday, November 24th, we'll be in Spring Lake at Spring Lake Memorial Missionary Baptist Church. Then we have two events at the health department on December 5th and December 12th. On Saturdays, we will do a walk-in clinic from 9 a.m. to 2 p.m. Any questions on the information that I have presented?
Very good. Thank you so much. Appreciate you guys going out to the community. Alrighty, so now we will let Dr. Green talk about the annual review for position.
Yes, thank you. So each year, as one of our accreditation requirements, it requires the board to do an annual review of my job description. And so that is included in your packet. So if you have any suggestions or comments that you'd like to make about the job description, the accreditation requirement just requires that the board review it. And then if you want to make any edits, then we can take that back to Human Resources for review and their comments and approval. But it just requires that you take a look at it, make sure that you've seen it, and to see if you have any changes. And so the first page on page 15, this is sort of our standard cover sheet for the job description. On page 16, we cover the work schedule, the working hours, and then the primary duties of my position. 35% are serving as the chief executive officer, and then are the individuals that I directly supervise. 20% is providing executive level oversight to our other programs, and then looking at performance expectations and performance feedback systems. And we've talked a little bit about that as we've talked about perform and learn coming on board. 15% is working on the mission and vision and the overall health department goals. On page 17, 15% is working with Ms. York on budget, revenue, purchases, and expenditures. And then working on the proposed budget to the Board of Health and then the commissioners as well. 10% is about collaboration with legislators, county management, and local government officials to assure smooth operations and effective partnership with community partners. And then, of course, 5% is other duties as assigned. And then on page 17, this part reviews the knowledge, section 3 reviews the knowledge, skills, and abilities that are required for this position, and the minimum training, which is a master's in public health and at least 1 year employment and experience in health programs and services. And then on page 19 also goes into some additional requirements for the job in terms of education and laying out what the minimum required training is. And when another accreditation measure is to look at to make sure that I've met those requirements and for the job. So if you have any questions or suggestions to make about the job description, we can take those to Human Resources for their review as well.
Is this, are some of these things also based on just kind of like what the state requires too?
Yes, so some of them are, as Candace calls them, state specs. And this is what is part of required in the job description. In particular, the parts about the required minimum training that aligns with accreditation and then the state, what the state requires as well.
Okay, so that's already incorporated in here?
Correct, yes. What the state requires is already, and what is a required, the minimum requirements for accreditation and what the job qualifications are already included in the job description.
Okay, very good.
Dr. Green, do you have any edits that you thought it was required? I mean, it looks pretty comprehensive to me, except that I would think that, I like how they do the percentage allocation. That's always interesting to me. It seems like in all our jobs, maybe 50% should be other duties as assigned, but as opposed to 5%. But
yes, and I think the 5%, Candace and Candy could probably tell me better, but I think the 5% is all that's allowed under the 5 other duties as assigned. But this year, it's probably been more, but that is part of the job. And I think, COVID probably falls under all of these categories in terms of percentage.
absolutely.
And I think this pretty well captures the duties that I perform on a regular basis.
I don't have any edits or changes.
Very good.
A minute.
Is this something that we need to sign off on or what?
No, we just need to have it documented in the minutes that the board reviewed the job description. So no approval needed.
Okay, very good. Okay, Ms. Curtis.
Good evening, everyone. So this is a little bit longer of a benchmark for you tonight, but I'll try to be as brief as possible. Next slide, please. So benchmark 39, the local board of health shall assure the availability of resources to implement the essential services described in this law. The law that you see here is the accreditation law that was adopted by the state legislature. If you go to the next slide. This lists out the requirements for this benchmark that is stated in that law. I'm not going to read them to you. I'll just pause for a moment so you can take those in. These should be in the back of your mind as I go through the next activities. Next slide, please. So activity 39.1, this is focusing in on communication between the Board of Health, the health director, and the Board of County Commissioners, as well as other units of government and private foundations. This one is specifically talking about support of local health department efforts to secure national, state, and local financial resources. So we're talking about grants. Next slide, please. For A, we're talking specifically about communication with the county commissioners. And then with B, we're talking about financial opportunities with other units of government or private foundations. This can be a variety of different things to show evidence of this. Board of Health meeting minutes, commissioner meeting minutes, emails between Dr. Green and members of the commission or Dwayne Holder, for example. One of the examples that we know of right now is our opioid response grant. We know that that was presented to the Board of County Commissioners as well as NC Harm Reduction, and they're a partner of that grant. So that should cover this activity. Next slide, please. Activity 39.2. This is talking about the review of fiscal reports to assure that essential services are being provided in accordance with local, state, and federal requirements. We have to show 2 examples here. Next slide, please. Candy did one earlier tonight. This is specifically the monthly fiscal reports that she provides to you all. We can pull from any of the years from 2017 and onward. Next slide, please. Activity 39.3. This is talking about annual review and approval of our budget and fees. And since the previous site visit, we have to have Board of Health meeting minutes that show that we reviewed and approved the fees. Next slide, please. So if we didn't make any changes with the fees between 2017 and now, we just need to make sure that the meeting minutes reflect that. Next slide, please. So for this one, activity 39.4, we need to communicate with the commissioners, other units of government, and private foundations in support of the development, implementation, and evaluation of a public health program. So A, again, is like most of these, is talking about the county commissioners and communication there. And B is talking about units of government and private foundations. Next slide, please. So for A, we have to show that we planned, implemented, and evaluated a program that was done by the health department and that we shared that feedback loop back with the county commissioners. For B, this could be maybe we did a presentation at the Mayor's Coalition or to a nonprofit, or one example that comes to mind is we have a couple of different grant projects with Fort Bragg that could be pulled for this. Again, this is meeting minutes, commissioner meeting minutes, emails between Dr. Green and another entity, but ideally this would be the same project as whatever we submit for 39.1. Doesn't have to be, but should be. Next slide, please. So 39.5, the Board of Health shall assure that the proposed budget for the local health department meets maintenance of effort requirements in the consolidated agreement with the Division of Public Health. So A is simply the consolidated agreement. B, I actually, when I copied my slides, I put in 34 or 39.4. So B is actually, since the previous site visit, a web identity role management, which is the WORM report that local health department sends to the Division of Public Health. So I apologize for my slip up there. Next slide, please. So for A, again, this is the consolidated agreement. And then for B, we can have Candy York pull a report for 1 month, and it can be any month chosen between March 2017, which was when our previous site visit was, to now. Do you guys have any questions? All right, thank you.
And so you'll hear us, as we are trying to make sure that we are meeting some of the accreditation benchmarks, especially as we're getting closer to our site visit. You'll hear us reference benchmark 39 or 38, or and we might ask you to make comment or to make sure that it gets reflected in the meeting minutes, because as we go through the accreditation requirements, we want to make sure that it's not just discussed in the meetings, but it's reflected in the minutes as well. So we might ask you to state more clearly that for the minutes, or state something so that we get it documented on paper for the minutes. So you'll probably hear us say that more often in the coming months.
Thank you so much. And now Dr. Green is going to talk about our external reports and audits.
Yes, so we just have one that is new this month, that is our accreditation letter from the Women's Health Branch. So this is an accreditation requirement that we shared this, that we received this letter from the State Health Department that shows that we are meeting all of the requirements from the Women's Health Branch, and that on-site monitoring was conducted. And so you can see the letter from the State Health Department. So we are going to retain, it's not necessarily an audit report specifically, but the report that you see on page 21 documents the status of our programs in the health department. And so on page 21, you can see if we have any corrective action, and if they're closed or open, and the results of that, and then the dates for all of our most recent reviews and monitoring. So you can see that for maternal health, we had one in 2018 for pregnancy care case management. We had one in May of 2020, family planning. We had one in 2018. APP, or adolescent parenting program, that you heard from last month. We had one in May 2019. And then home visiting for postnatal assessment, we had one in 2018. And then you can see the whether or not they had any review findings for those in summary, and then if we had a corrective action plan, and if those were open or closed. And all of our corrective action plans are closed. So this is the letter that we'll submit along with our accreditation documentation.
One thing that I did note is just, so these are suggested programs for health departments?
So these are all, so some of them are, but once we sign our agreement addendum, we are contractually obligated to perform those services. So for example, every health department doesn't have adolescent parenting program. Every health department doesn't have a REACH program. We don't do, we do the home visiting. We did have ICO for MCH, but that funding ended in June. So every program is not offered in every single health department.
So what I was curious, so like I counted like 20 possible programs, but we only offer 5 of them for us to be the largest the 5th largest county in the state. So how does that kind of, I mean, I'm just asking a question. I mean, that we only offer 5 of state suggested programs.
And maybe Crystal could probably speak maybe a little bit better to that, about which programs we don't offer and why. But I don't think, and correct me if I'm wrong, Dr. Benson, but every program, there's not funding to fund every program in every single health department. So some of these, like for example, ICO for MCH, they choose where that's offered. It's not offered in every single health department because there's not funding to offer it in every health department. So some of these are not because we don't think they're a good idea, but their funding is not available to every health department. Is that a fair assessment? Yeah. The ICO for MCH, for example, I think it included several different regions or several different counties. And then this year we were not included in the counties that were funded to go forth on the next cycle of ICO for MCH grants.
I guess, you know, like say for instance, like, you know, we know that we have a, you know, maternity, health concerns and then infant mortality. You know, I mean, could that be something that we could be looking into to provide for our county to improve our numbers?
So Eric, I think you're specifically looking at the infant mortality risk reduction. So if there are funding streams that you would like us to look into specifically, we can definitely do that. I'm not as familiar with all of the programs yet. So for example, I'm just not as familiar with the infant mortality reduction program or the Healthy Beginnings program, but if that's something that the board is interested in, we can definitely look in to see when those funding cycles come and if we're eligible to apply for them. We're not always eligible to apply for every single one of the grants. Many times they pick the priority counties where the rates are either the highest or there's the greatest disparity. So, but we can go through and kind of look into each one of the ones that we do not offer and share more information at the next meeting.
That would be helpful. I mean, the form, as Dr. McMahon's alluded to, it kind of suggests that, you know, could we be doing more? Should we be doing more? Because of the way the form is, and maybe that's not a fair assessment, but just the way it sets up, it leaves one to question that.
Okay.
So, yeah.
Yes.
So maybe you can just give us some more information about how comprehensive our programs are, and if there's things that we should try to do, then we should do it, I guess. So.
Absolutely.
Also, I was thinking that when we do our annual goals, then that could help drive the ones that we might want to take in consideration.
I have a question. Because I saw on the news that, you know, you're talking about infant mortality rates, that like we are one of the larger counties. We have it's like 18% or something, and Wake and Durham, they're in single digits. So I would like to, you know, it'd be a good idea to try and reduce ours. It's really high. I think that maybe the Infant Beginnings program, I'm not familiar with the programs either, but I think that would be something good to look into.
And yes, and others, please interim, please chime in. So for example, the ICO for MCH, that program was designed to also address infant mortality. And the same thing with our CC4C PCM program, which are now called different things on here. The CMARC and CHART programs are also, or at least the CMARC is designed to address infant mortality through the high-risk pregnancy program. So we can go outline which programs we don't offer and why. Some of the answer to that is funding availability. And then with a special look at infant mortality rates and which programs address some of our key health issues, including infant mortality, low birth weight. Some of the programs, of course, address across the lifespan. So we can do that.
Thank you.
Wonderful, wonderful. And preconception health, you know, people forget about that. You know, we have to have a healthy mom, female, before we even get pregnant. So, fantastic. Thank you so much. I'm sorry. So now we will hear your report for COVID.
So I'm going to apologize in advance because I'm going to throw in a couple of things that are not on the slides because they happened this afternoon. So we'll start with, under my director's report, we'll do COVID. And then I'm going to talk about the Partnership for Children Health Consultants. And then I'm also going to talk about just a little bit about tobacco at the end. And then give a brief strategic planning update as well. So for COVID, we'll start with the numbers and where we are. As you know, if you tuned into the press conference at 3 o'clock from the governor, our numbers are increasing widely in Cumberland County. I pulled this data down yesterday. So we have more than 8,200 cases. I believe when I looked today, we fed in about 100 plus cases today alone. So our numbers are continuing to increase for COVID-19. And then on the next slide, you can see the number, and this is, I pulled this data down yesterday, but in the last 7 days, we've had 477 cases. In the last 14 days, we've had 913 cases, which if you do the math means we've had more cases in the most recent 7 days than we've had in the previous 7 days. On average, we have 66 cases in a day, but as I just mentioned, there are days where we have more than 100 cases of COVID each day. And then our daily cases per population size, 100,000 is 24.4 cases, and that is a 7-day moving average. The state, on this next slide, the state health department put up some new data on their dashboard. And so if you look on the state health department dashboard, there's a tab that says case demographics. And so you can see over time how the demographic data changes. So this chart shows by race since the beginning of the pandemic to now, and each of the bars represents a racial group. And so you can see that African Americans consistently represent the highest percentage of our cases over time. And right now we're at about 45% of our cases are among African Americans. And then the next highest group are among those that identify as white. And so this gives us a good look to see who's being impacted the most. And then on the next slide, there is the breakdown by age. So this is really helpful for our school district to get this information. It shows the breakdown in a way that we haven't been able to see before. Before we've just got sort of snapshot data about our age breakdown each day. You could go pull down the data, but we really haven't been able to see it in trends over time. And so this breaks it down by age group 0 to 1, 2 to 4, 5 to 9, so on and so forth. So you can see whether it's, you know, the youngest children or the older school-age children or your middle schoolers or your high schoolers. And you can see the age breakdown over time. By and large, though, the most cases are among those that are between the 25 to 49, even regardless of what week you look at. Most of the cases are among that age group. And currently about 45% of our cases are among that age group. I didn't put the slides here, but also on the website, there's a breakdown by gender over time. We are pretty steady at about 50-50, depending on the week, of breakdown by between male and female, at least in terms of cases. And then there's a ethnicity breakdown as well. On the next slide, this shows our case positivity rate. So we're at about, I think actually today we're at 8.9%. And our target is 5% per the World Health Organization. The bit of good news is that the State Health Department set a target for us to test approximately 5% of our population every 30 days, which works out to be somewhere around 4,200 tests every week. So the chart on the slide show week over week the number of tests that we do. So for the last several weeks, we have done more than 4,200 tests. And by we, I mean the county, or we, I mean all the providers in the county, not just the health department. This is a number of tests, both all of our testing that happens in the county week over week. We've hit that target, but we'd like to see more free test sites. And I'll talk just a little bit about what those are, what's coming. There's starting next week, there's going to be new test sites at New Life Bible Church. That's a collaboration between the State Health Department and a vendor named OptumServe, and they're partnering to do that. Our team has been fairly heavily involved in that process and getting the test site launched and working with the church to make sure that the test site can go off flawlessly. And so that starts next week on Mondays, Wednesdays, and Thursdays. Are getting ready to travel about for the Thanksgiving holiday, to go get tested for free. And it's from 9 a.m. to 6 p.m. each one of those days. So we're working with the State Health Department and the state vendors to increase capacity for testing throughout the county. And then we are also working with several partners to get antigen testing up and going in the county as well, with some limitations. So on the next slide, we have some information about our recovery data In our death data, we
Dr.
have.
Green?
Yeah. Yes, is there a question?
Dr. Green?
Yeah.
Can you hear me?
Yes.
Yeah, hey, Sam. The testing you're gonna be doing Carly sees and some of these, what's the turnaround time for the results of those tests?
So when we talked with the vendor yesterday, they're estimating, the OptumServe folks are estimating 24 hours to 72 hours. Their average time was 28 hours.
Okay, I'm just, people are going to get the test right before Thanksgiving, before they go to Thanksgiving dinner with everybody else. I was hoping they get the results back before they went, so.
Yes, the hope is that if you get tested on Friday, that you certainly have it either the next day or by Sunday. And then I guess if you got tested on Sunday, you'd have it before you leave if you travel on a Wednesday, that you'd have it before you leave. So ideally people would get tested earlier in the weekend, but some states require, we've gotten more requests. They need it on a particular day. I need it to be exactly 3 days before I leave or get on the plane. So we're still, every now and then, I think we field some of those requests as well.
Likewise, we do too.
I'm sure. Yes, and so it's kind of hard to judge, to tell them the exact day to come, because we don't know. Sometimes the test result takes longer, sometimes it's not. So it's a little bit hard to tell them, to help them time it exactly. It really just depends on the lab capacity that day.
My focus was just knowing that everybody's going to get together for Thanksgiving, then going into that, they would have a COVID test till, I guess, if they're unsure, so.
Yeah, so hopefully, I think that's why they're doing it this weekend and not earlier in the week of next week, to try to get people before they leave out. And then of course we're testing on Thursday, so that's an option. And then tomorrow at Mana Dream Center, that is also an option for people to go tomorrow to get tested. And that's also that at the Dream Center, that vendor is also OptumServe. So if they go get tested tomorrow, then they will have their test results before if they head out over the weekend, they'll have their test results ideally before they leave. So people need to do a little bit of planning ahead. And we'll talk about Thanksgiving here in a minute. So we've had 111 deaths so far. Of course, most of our patients are presumed to be recovered. Among our death data, of course, most of them are older adults, male, African-American, most have a comorbidity, and most it's about 50-50. It changes a little bit week over week, but about 50-50 that live in congregate living settings. So that changes a little bit, but not everybody. A couple of vaccine updates for COVID. Last month, we told you we were submitting our vaccine provider agreement. So that has been approved. We've had a few calls with the hospital. So thank you, Dr. Fleshman, for your team about planning for COVID vaccine distribution and making sure we're on the same page as the hospital and working together in tandem. So the phase 1, which will have limited doses, the state health department has prioritized critical healthcare workers, which will be hospital staff, COVID response staff, essential workers, which are really actually in phase 1B, which includes our first responders, long-term care facilities. I think we talked about last time, our long-term care facilities are going to be vaccinated by CVS or Walgreens through a partnership with the state. And then also planning to think about how we're going to vaccinate those that are homeless and those that are incarcerated as well. So that's, if you probably count out the population sizes, that's way too many people that are in phase 1 based on the supply of doses that we're going to get. So we anticipate that we will still have to do some prioritization even within those levels. But we also know that in the first round of vaccine availability, that people are going to be hesitant to get to get it. And so we've been pushing the state to say, okay, when the EUA comes out from the FDA, please make sure that we have plenty of safety data. And the state health department is also going to work on some messaging about safety related to the vaccine, and then of course how effective it is once that data is available. So we're in the planning stages for that. We've sort of checked our boxes right now in terms of the paperwork that we need to get to the state, but we're we're sort of in a waiting game right now until we figure out until we get more information about which vaccine we'll be able to provide and when.
Dr. Green? Sorry to be interrupting.
Oh, go ahead.
I guess Sally, Shute, and the county are going to be on board with this PR campaign?
Yeah, so we haven't got the materials yet, but we will work with PIO. They've been working with us already to make sure that we can get some campaign materials. So once we get those from the state, we'll share that with Sally's. They've helped us push out other state materials already through the Slow COVID NCE app, the Get Behind the Mask campaign. So the state health department is supposed to be putting together this package of communication materials that will go along when the vaccine is available about the safety, how effective it is, and then we will push that out with Sally's team. Because I mean, that's going to be
Okay. I assume that'll be jointly done with the health systems.
Yes, and so we've been sending Chris Tart. He's been sort of our Chris Tart and Amanda have been sort of our contacts, and why am I blanking on names? Your safety,
Doctor?
your preparedness individual. Thank you, Robert.
Weren't Brian Pierce?
Pardon me?
Robert, yeah, Robert.
Robert, yes, we email each other back several times a day. So we've been on communication with them and emergency management with the county to make sure that we're coordinating efforts. And so we actually sent, I think, some communication back with them yesterday about the most recent updates from the state. So they send us FAQ documents on a regular basis, and then we share that back out with Robert and Amanda and Chris.
Right. Okay, I just want to make sure when the messaging goes out that we can do a joint thing with the county and the health system together to maybe help with the PR campaign, because I think that's going to be a big piece of it to our community.
Yes, and I am not good with names today. Your PIO person, Jenny, Sally and Jenny, and I can help you have that as well.
And we have a new, VP of communications, Chaka. I'm trying to think of Chaka's name, but we'll
Yes,
get
I
over
met
to
her. I think I met her last week at WIDU.
I think it's Chaka Jordan, I think her name. Yeah.
Yes, I met her. So we will make sure that gets pushed out to them as well. I have not seen the materials yet, but once it's available, we will. Okay, so a quick, maybe not quick, but some conversation that we are interested in hearing from this group about the executive order. So last month, I think the day after our meeting, we shared out with the board the letter that Secretary Cohen shared with the county managers and the municipalities about local actions that could be taken at the local level to do some mitigation strategies and slowing the spread of COVID. Specifically, what are some legal actions that could be taken? So we continue to get complaints about the executive orders and their the violations of the executive orders. And the way the executive orders are currently written, it is not enforceable by local health departments. We don't have any enforcement authority over the executive order. Our role has been to provide education to the businesses or the restaurants or whatever the facilities are, but it's enforceable by local law enforcement in the jurisdiction where the violation has actually occurred. So we can't actually go out and tell you, you can't do that, or you can't have that mass gathering because that's not the way it's written. So what we've been doing is the state health department has provided us with some template letters that we can use and send to businesses when we get a complaint. And we sent those letters probably about 2 weeks ago. We started sending those letters to anytime we get a complaint, we take the information and then we share that information. We send a formal letter to those businesses telling them they need to comply, and that if they don't comply, that it is enforceable by legal action through law enforcement. Sometimes we hop on the phone with a manager or a business or a facility and explain the executive order, or sometimes it's via email. We sort of do it. We have a couple different approaches to that. Today, the secretary, I'm going to jump back, Kelly, if you'll pull up that report. Right before the meeting, I sent you, everybody, an email with this document. The governor, about 3 o'clock today, the governor released, and the state health department released a report called the, Kelly, you're gonna have to make that a little bit bigger for me, I'm sorry. It is a county alert system report. And the way the county alert system report is it ranks counties by color based on their a couple of different metrics, and those they're either red, yellow, or orange. Cumberland County is in the orange, and the metrics are based on our case positivity rate, our rate per population, and then a hospital composite score. So Kelly, if you scroll all the way down to, I believe, the last page in the document, or the second to last page of the document, keep going. Yeah, that page. So if you look at Cumberland, Kelly might have to make it a little bit bigger again. I'm hard of seeing. So we are in the orange. Cumberland County has a case positivity rate. You might have to use it the next page. There we go. Okay, thank you. Cumberland County is on the bottom of page 9 of this report. You should have it in your email. We have a case positivity rate of 8.7. Our cases per 1,000 over a 14-day period, 259 cases, 259 per 100,000 population. And then our hospital impact score is actually good. We have a low impact score for our hospital. So that gives us a rating of orange, or an alert system level of orange. And they use those metrics that we discussed. To be in the orange level, your case positivity rate has to be over 100, and that aligns with the White House Task Force report. And then you either have to have a 14-day case positivity rate above, is between 8 to 10% or above, and then or a hospital impact score that is high. So Cumberland County is in the orange. And then Kelly, if you go back up again, I'm sorry. Go back up to page 3. Starting on page 3 of this document, it gives some recommended actions that individuals can take, counties can take, or businesses and community organizations can take, and public officials can take as well. So this outlines, based on your level, whether you're orange, red, or yellow. So we are orange, so we're on the left or the right side of your screen. And so you can see that the report recommends that if you're in an orange county like we are, you avoid mixing households together, you avoid congregate settings like bars and nightclubs, you do takeout instead of eating indoors, you limit, even if you limit public interactions with others that are non-essential activities. And then on the next page, it gives some things for businesses to do to make sure their employees are, to do teleworking if possible, and if not possible, to, especially for restaurants, to do that count on me training we've talked about months ago, give some guidance for institutions of higher learning, encourages our faith community to limit gatherings inside their facility to 25, which is, I'm sorry, to 10, which is the current mass gathering limit indoors. And then on page 5 of this report, it gives some local actions that public officials can take. So that's where I want to pause for just a minute. These align with what came out in the letter a couple of, maybe a month or so ago that we sent to the board, and what is possible or what recommendations are. And we haven't delved into all of this yet. It just came out today. But I'm going to hop back to the PowerPoint because I want to review with the board what is one of your, what's one of the tools that are in your tool belt that you can use and get thoughts from the board about what you might be just get your thoughts and feedback about it. So the Board of Health, Kelly, if you'll go back to the slides. So the Board of Health has the authority to adopt local rules. And that's laid out in General Statute 130A39. And I'll give this disclaimer. These slides aren't mine. Jill Moore from UNC School of Government presented these to the local health department directors. And so these are her slides, but I'm just repeating her information here. So, and then there's also, this is available on the UNC School of Government website as well. Just recategorized into slides here. But you have, as a Board of Health, have the authority to adopt local rules that are that can protect and promote the health and safety of the public. You can, as the Board of Health, adopt laws that are more stringent than the state, with some limitations that we'll talk about in just a minute. And the rule, if you adopted a rule, it would apply throughout the county, through the entire county, not just in the unincorporated areas. So whereas if the commissioners passed an ordinance, it would only apply in the unincorporated areas, your rules apply county-wide, even in the municipalities. If you wanted to pass a rule, it would require 10-day public notice to the public of any new rules or rule changes or repeal. So you do have to notify the public. The things that you cannot do on the next slide, you can't pass any local rules concerning grades or permits to local food and lodging. That is off limits. You cannot do, if you pass a rule, this is a little bit irrelevant here, but just for your information, wastewater rules have to be at least as stringent as the state law. And then you also cannot do rules, any rules that are applying to public smoking have to also be approved by the county commissioners. Put that in your back pocket for just a minute. We're going to talk about that in a second. But I gave a little bit of a tobacco update, but if you did any rules regarding smoking, it also has to go to the commissioners. So the rule has to be, on the next slide, has to be related to, it has to meet 5 criteria, has to be related to the promotion and protection of public health. It has to be reasonable in light of the health risk. It can't violate any state law or constitution. It can't be discriminatory, and it can't make distinctions based on policy concerns traditionally reserved for the legislative body. So that's a mouthful. On the next slide, also, you can't preempt. There's some rules about preemption. So if you have a local rule, some things are off limits, which we already talked about, but you cannot adopt a rule that's less stringent than the state rule. So you couldn't adopt anything that's less stringent than the current executive orders, for example. However, the general statute does allow you to adopt rules that are more stringent than things that are regulated by the state. So more stringent than the executive orders. You can do that. But you have to be able to explain why you want to adopt something that's more stringent than what's laid out by the state. One of the things asked that was in the letter from Secretary Cohen was, in some counties, you should consider adopting more stringent rules if that's something that the Board of Health would be interested in. If you make a rule, on the next slide, you have to have 10 days notice. You can't just adopt it tonight at this meeting and then say it's implemented tomorrow. Notice is required. It has to be available in the county clerk's office. It has to be put in the newspaper. There are several things that are required to make a rule. And then on the next slide, you can adopt a rule as long as it's done in an open meeting like this one. You do not have to have a hearing. It's not required that you have a hearing by state statute. In addition, if you do adopt a rule, it is effective at a later date. It's effective upon whenever the board decides to adopt it, unless you specify a particular date later down the road. So that's where your authority lies as the board. You can adopt rules. And the reason I'm bringing up the county alert report and that letter is that one of the things that was in that letter is for health directors to make sure that we present this option to boards of health, that to remind you guys that this is well in your scope of authority, that you could adopt rules related to COVID, and if that was something that the Board of Health wanted to do. So just wondering what your interest in that is, or what your thoughts are about that, and just wanting to have a little bit of conversation. I know I'm looking at the clock as well, but just wanting to see where the thoughts of this group is.
I'm just going to be honest with you. I mean, you told us a lot, but you know, at the end of the day, we all know what we're supposed to be doing. I mean, the issue, there's a reason why COVID is still here, because people are in the United States believe in individual rights and quote unquote freedoms. You know, we have a problem with public health and protecting the greater good, and people don't want to quote unquote impinge upon their own personal rights, and we don't want to be told what to do. We all know that we should be at home and you shouldn't be out. You can go out on, you know, anytime on Skyboat and it looks like COVID has never existed. You know, why is that? Because people want to do whatever they want to do, no matter what they're being told. You know, despite the fact that the numbers are steadily increased. I mean, we got a call last week that schools are going to be opening up in January. Why are the schools going to be opened up knowing that the COVID numbers are steadily increasing? You know, people talk out of both ends of their mouth. I'm frustrated with COVID because people talk out of both ends of their mouth. You know, we say that we want the numbers to decrease, but we don't want to do what's needed, and that's to stay home. It's business as usual. People talk about making money when people are steadily getting sick. I mean, and we know what we're supposed to be doing. I mean, so what other rules do we need to make?
Well, so your authority, and I'm going to admit a shortfall here, is that
do you understand my frustration?
Yes, I do.
As a doctor?
We hear it every day. I mean, our poor contact tracers probably get the brunt of it, and our staff that field phone call complaints. We talked about the letters. I think, Kelly, between yesterday and today, I've given you probably 8 letters to send about businesses that were not following the executive order. So, I mean, but we don't have much enforcement power at that. Let me not say that. We don't have any enforcement power of the executive order at the health department. So this is an option that is available, and what the letter from Secretary Cohen said that if boards of health were interested, you could adopt stricter rules or assign either civil penalties to those, or and that's where I'd want to get Rick Moorfield in here to kind of walk us through what you can do. But there is, if the Board of Health adopted a rule, there would be a different enforcement actions that could be taken. Let me just say it that way. Whether that is a misdemeanor or a civil injunction, that could be, there's different enforcement power than what is included in the executive order.
So what we're going to do, go have policemen patrol every business on Skybo and start arresting people, you know, finding people? I mean, is that the answer?
Right now, we are taking, we're really sort of working off of complaints and what we get essentially in our inboxes, or if we see something on social media, somebody might draw it to our attention, or if we get a call about it, or that's when we typically will send out the letter or take action. But again, we can't, there's not much other than sending the letter and providing, and let me just say, we provide as much education as we can to say, here's what the executive order says, here's what you're required to do and not allowed to do, and here, how can we help you come into compliance with the executive order? Did you know that exists? Is there a resource that you're missing? Can we help think through how you can meet that executive order? How can you be creative? I mean, that's what we've been doing so far.
The executive order needs to impose a lockdown again. I don't understand this throwing this onto the local boards of health. That really should come from the state level, like what we did happened in the beginning. Needs to go back down to doing a lockdown. That's the only way you're going to control the numbers. It needs to be a statewide lockdown.
And the governor a little bit addressed that on the press conference today. I think a reporter directly asked him that question. Well, are we going to go back in some variants of this? Are we going to go backwards? Are you going to impose, further restrictions? And he referenced again that, and I'm just telling you this for your information. I'm not telling you one thing or the other, but that the letter was sent and wanting to give counties the opportunity to address things at the local level and before additional actions were taken, but did not take off the table that additional actions would be taken. He said, if our numbers, and if I mischaracterize that, somebody please correct me, but if our numbers did not continue to move in the right direction, then that would be something that they would consider, but did not say that is something that they absolutely.
Like I said, I get frustrated. To me, people are talking out of both ends of their mouth. I mean, I find it kind of frustrating that, okay, so we know that on Thanksgiving, people are going to get together, but and they shouldn't be getting together. And we're telling people, oh, it's okay because your test is negative. I mean, really, is that the message that we want to be presenting to people? That's exactly what people are going to feel when you start doing that testing this weekend, that it's okay.
Yeah, and I mean, you're not wrong.
I mean, it's just frustrating.
Yeah.
People are tired. People are not, they're tired. So,
Well, we're going to see the numbers increase after Thanksgiving.
Even if you had a state shutdown, even if you shut down the state, you think people are still not going to get together for Thanksgiving? I mean, I just don't think you're going to stop it, regardless of what the governor says.
Yeah,
but we're sanctioning it by saying, okay, get a negative test and then you can do whatever you want.
Well, I don't agree with that either, but yeah.
I think that's what they're in sort of mitigation mode, if you will, that, hey, we need, we know you're going to do it. So at least try to, in some ways, at least reduce your risk, although of course it's not a zero risk for sure. So I think that's what the thought process is there.
One thing too about passing local laws on the spur of the moment, there is a lot of liability associated with that. There would have to be a lot of lawyers and legal advisors to keep us from making some laws that would be unfair or would come back on us.
Right. And that's why if this group is interested in that, I am not a lawyer, we would consult with the county attorney before taking any additional action. And if the board is interested, we can invite the county attorney to come and talk more about what is possible. The state health department has also said they can also provide some assistance and draft language and ordinances that can be, or you wouldn't be able to pass an ordinance, yours would be a rule, but some draft language and sort of technical assistance, if that's something that that this group is interested in, we can definitely pursue that.
I think they're just trying to pass the buck to make
You said it right, Ms. Cox. They're passing the buck. They're having the local boards do their job.
Well, they're not going to, not going to have any teeth in it, so.
And they're not going to be forcible either. If you can't reinforce it.
No.
It's just another rule. That's another rule that's stated. with no authority or ability to
Yeah.
require individuals to follow suit. And then again, that goes back to the fact there's legal ramifications as well.
Yeah, I know that Dr. Cohen is adamant, but, and maybe they could, but I just don't see them, unless the hospitals get overrun, I don't see them shutting things down again. That's just, but what do I know? But.
And on the enforcement authority for the rule, if you did a rule, you could, and Rick could tell you more about how the exact enforcement, but there's a criminal enforcement tool that would be a misdemeanor, or you could do a civil injunction. And then in some instances, I think you could do a civil penalty or a fine. All of those things that we are not able to do, we meaning the health department, in the current executive order, because that's just not where our authority lies.
Dr. Green?
Yes.
In reference to the vaccine, is that going to be voluntary, or will there be some form of enforcement related to that?
So what we've heard from the state so far is that it is not going to be mandatory. They are not going to make it mandatory for anybody to get it, including for schools. They won't make that a mandated for entry. So there are other immunizations that they do mandate, but that will not be one of them. That's what we've heard as of today. I think there was some question about the legal authority to do that, especially right now, because it's under, when it gets passed, it will be under an EUA and not fully FDA approved. So can you mandate something that actually hasn't been FDA approved yet, if it's operating, at least in the beginning, under an emergency use authorization and not with full FDA approval? So the short answer is not at the moment, not to my understanding.
Because I think there would be better outcomes with that, with a vaccine that's proven safe, that would have better outcomes with that versus trying to enforce rules that people are not going to comply to. Folks won't even wear masks. I mean, there's just so many things they won't do. So if the state's not even going to mandate a vaccine that could be effective, I would find putting in more rules to be just an exercise.
Exactly.
I don't know, and again, I'm not a lawyer, what their legal authority is to require that. Where they've required or mandated vaccines now are in childcare centers, and then, of course, in at schools. But my understanding is that they're not going to do that, at least in the immediate.
I have a question. Did the school board or the school system consult with you about reopening the schools?
So we do, and so we do a weekly metrics call with them. And so based on our conversation, Dr. Command, we don't provide a recommendation because it's not really in our scope of authority to say schools, we have isolation and quarantine authority, right? We can say it's not safe to be open, but we don't have the authority to say you should be open. And so we have provided the metrics for them every week based on, we provide, every metric that you could possibly think of: case positivity rate, test numbers, by population, by age, clusters, any COVID metric you can think of, hospitalizations, we provide it. And then we do a call with them on Monday mornings. And then we've also done a fuller presentation to the board of to the school board. That was maybe 3 or 2 weeks ago. And then we also did, the state health department does a monthly call with all the local health department directors and the superintendents, at least on a monthly basis, if not more frequent. And then at least one of our team, if not several of us from the health department, participate in that call. And Dr. Conley is typically, or one of his staff are typically on that phone call as well. And that's where they provide sort of state level perspective about what's going on with schools. And so if the board is, I would like me to, I'm going to continue to participate in those calls, in those metrics calls each week.
We'll see how all this works out. Okay, anything else on COVID?
So I just want to make sure two things. One, that does this board see it a necessity to have Mr. Moorfield or the commissioners kind of looped into this conversation, or at this moment, that's not something that you want to pursue?
No.
Okay, I'm hearing a no. And then the question about, for me representing the health department, those continue to do that at the school board meeting. Is that something that that the board is still wanting me to be able to do?
Of course.
Okay, so those were all the COVID things. Really quickly, just a couple of updates about Partnership for Children. They have some funding from the state health department, or some funding has come down from the state to expand what they're calling child care health consultants. And they have some funding from the Department of Education, and I'm going to forget the acronym here, DCDEE, to expand the statewide network of child health consultants, and funding this in a regional manner. And so these consultants would work with child care centers to make sure that to provide coaching for the child care centers. So Adrian's team comes in and does some inspections, but this group would be a little bit different, and they're really not on the enforcement side, but on the consultation side. And so we are looking to partner with Partnership for Children. The funding is going to go to Partnership for Children, and then the health department would be the agent that would hire a nurse to help these child care centers and be sort of their nurse consultant. Not the right term for that, but that funding will come in December, and then starting the hiring process in January. So we're working through that right now. We just are getting very preliminary information about it. And so more to come, and we'll bring that information back to the board. The last update I want to, and ask for the board is Travis, who was our regional tobacco coordinator maybe 2 or 3 weeks ago, presented to the county commissioners about tobacco and gave an update and described some of the work that the Board of Health has done with passing your resolutions, and really to bring the Board of Commissioners back up to speed about what is going on with tobacco in terms of tobacco 21, menthol flavors and flavored e-cigarettes, and then remind them of what authority they have and what authority you have as it relates to no smoking ordinances in the county. So our next step, if this board is on board with that, is to have Travis go to the Mayor's Council meeting in January to share more information about what are the abilities to pass no smoking ordinances in not just in the county, but in the municipalities as well. And so if you would designate one of us to do that, we will be happy to represent at the Mayor's Council meeting in January.
Yes, please. What happened to the statement that we made about the tobacco shops being a certain distance from the schools?
So that was one of the things, and Ashley, you chime in where I missed a step, that Travis reminded the commissioners during the meeting that was a resolution that the board passed, and then presented some new tobacco data, some mapping data that shows where the tobacco shops are in relationship to the schools. But remember I told you a couple slides ago to put in your back pocket that any ordinances have to be passed by the board and then by the commissioners as well. And Ashley, if I misspoke on that, please correct me. But you guys would both have to do that. And they actually just yesterday, they did that in New Hanover. The Board of Health passed a rule, and then the commissioners, I believe, approved the ordinance yesterday. So they they're now smoke and tobacco free.
So what we did was not enough? Is that what you're saying?
It has to go to the commissioners to approve that. And that's what Travis gave them some information to remind them that the resolution alone doesn't make it so. It has to, the authority has to be approved by the Board of Health and then also approved by the commissioners.
So I'm saying, have we done our part, or do we need to do anything more for that?
I believe there needs to be, and Ashley chime in where I missed this part, but you guys have to pass, I think you passed a resolution, but it didn't ever get approved by the commissioners.
Okay, so we're just waiting for the commissioners to approve what we already stated.
I can chime in here. So the resolutions don't hold legal authority. They're more of a suggestion and a support. If you did want to go fully into a Board of Health rule around zoning, it would only cover the unincorporated areas. But then if it gets approved by the commissioners, we could include it for everyone. But it wasn't an actual ordinance that you all put forth. It was a resolution of support.
And we started that, I think, when I think one of them got passed before I started, and then the other one was maybe in December of last year. And I think at that time, the plan was to go forth and take the next step, and then COVID happened. So I think that's where we were, started with the resolution, and then wanted to circle back to the Board of Health. And Ashley could probably provide some history here. But last time it was brought before the commissioners, there wasn't support from the commissioners to actually take the ordinance all the way. So I think that was the conversation we were having pre-COVID at a Board of Health meeting, I think almost a year ago in December, that did we have the support to be able to pass? And so I think where we settled was we'll pass the resolution and then see what steps we can additionally take.
Okay. So at least so Ashley says that we need to do our part and actually turn that to go from a resolution to an ordinance.
Correct. And I think maybe what we can do is have Travis come back again, and we can kind of talk about how we want to go forth with this board and then with the commissioners, because both steps have to happen for it to be passed. And so they are aware now that probably the presentation at the beginning of November, that is the authority they can do, that they have to take their step as well. But remember, we have another new commissioner coming in January, so we'll have to do some education for our new county commissioner so that we make sure that that individual is aware of what the authority is. So we have some education to do on our side too.
Mm-hmm. But at least we can do our part and create the ordinance.
Correct. And I believe Travis already has, based on what other counties have done, has draft language that can be used and okay. Questions as well about where it can be applied.
Yes, that's correct. We have model language that you can use, and then you can just pick and choose what sections you want to take out. So if you don't want to cover Parks and Rec, for example, that's a section that could be removed hypothetically.
So if everyone is in agreement, then that's something that we should move forward with. If you could present us those materials for our next meeting so that we can create that ordinance.
We can, the board, yes, we can have Travis come back next month.
Thank you.
Dr. McMahon, I have a question on that.
Please, go ahead.
I'm just curious, how is it that we would be able to pass rules related to COVID-19 through the entire county, but these tobacco ordinances are limited only to the unincorporated areas?
Yeah. I picked up on that language too.
So
Sure.
Go ahead, Ashley.
So the biggest issue is that we're preempted from a lot of things at the state level. And so a lot of different areas are preempted. And this just happens to be one of them. And tobacco is actually the only health rule that has to also go before the commissioners. So that's the main reason.
And Ashley, can you talk a little bit about what other counties have done where their municipalities have also signed on to and adopted what the county did?
Sure. So there is the option to do an opt-in or an opt-out for municipalities, and that kind of skirts the line for that. So if we did pass a Board of Health rule and it went to the commissioners, then at that point, the commissioners can pass it with an opt-in.
Meaning all the municipalities could sign on to this. And I believe that's what they did in New Hanover.
Thank you for clarifying that.
Is that correct, Ashley? That's how they did it in New Hanover?
I believe so. I'd have to look into that with the Region 8 Regional Manager, Ernest Watts.
Okay. But we can have Travis come back and do the presentation again and send the sample draft language to the board so we can discuss it at the next meeting.
Thank you.
And then we'll also plan to have Travis go to the mayor's council meeting because as Ashley said, they would have to either opt into for it to be enforceable across the county, they'd have to opt into that. That is all I have. Thank you.
Thank you. So again, everyone look at their roster and attendance report. One thing, does anybody have any comments? Anything that you would like to have, like to talk about or topics to discuss with the next meeting?
I'm good.
Thank you. So we are coming up on the end of the year and it is time with our next meeting, it will be time to vote for our new chair, okay? And vice chair. As a general rule, the current vice chair steps up to the plate to become the new chair. But of course, if anyone is also vying for the position, please throw your name in the hat for us to vote for. And then, of course, please consider yourself for the vice chair position also. So we look forward to our nominations with our next meeting and to be able to vote so that we'll have our new chair and vice chair for January meeting. All righty. Thank you, everyone, for attending. We really appreciate it. I hope you have a fantastic evening and may I have a motion to adjourn now.
And sorry, Jeffrey.
Thank you. Be safe.
There's a comment at the bottom of your agenda. As requested by the board last time, we're requesting public comment for the public on our strategic plan. So is that okay? That we'll have that time for the at the Board of Health next meeting.
Okay.
Wonderful. Thank you for that reminder.
All right.
Thank you, everyone. Have a good evening. Be safe.
Thank you.
Thank you.